Welcome back. Now, do you know what is one of the most common plastic surgery procedures done in America? If you said a nose job, you would be 100% correct. The medical term for a nose job is rhinoplasty, and according to the latest statistics from the American Society of Plastic Surgeons, more than 213,000 people received a nose job in the U.S.
That's incredible.
Each year. Now, our next guest has been featured on so many national news programs. He's one of the only surgeons in America whose entire practice is dedicated to closed, scarless rhinoplasty. Dr. Deepak Raj Dugar, MD, is a leading board-certified facial plastic surgeon and founder of the Beverly Hills Rhinoplasty, where he's transformed people's lives from around the world and with his artistry and his skill. Dr. Dugar, thank you so much for being with us.
Thank you so much for having me. It's my pleasure.
Oh, it's our pleasure.
I don't feel self-conscious. I mean, we're in front of a world-renowned plastic surgeon.
Well,
I'm like, oh
I mean,
my God, I
we
feel
were
a little
astounded.
defective.
We were astounded to hear the number of surgeries for noses done in the United States.
Right. And that's probably, to be honest, underreported. It's probably even higher than that because not every surgeon participates.
So, I mean, as a dentist, I'm dealing with facial beauty all the time, and my area is the mouth and how that frames the face and is a part of it. But it brings us to really a fundamental question. What is beauty? Where do the concepts of beauty really come from?
Yeah, that's a great question. And I think that it's something that I'm trying to preach about more and through my new book that I wrote as well, talking about the concepts of beauty that have been sold to us. There is a consumership about beauty always, and myself included as part of this consumership. And we have to remind ourselves using awareness and just bringing more awareness to the topic that most of us are being sold on a daily basis. And that's where our beauty ideals come from. Did you know that we see on average between 4,000 to 10,000 advertisements a day, the average person living in the USA? And I'm talking from the labels on the clothes you're wearing to the billboards you drive by.
So
to
now
the restaurants.
Instagram, I know the teenagers are all about Instagram, and now you can with the filters, you change your look, and some kids think that's real. Yeah, it's really.
So are our concepts of beauty in America the same as they might be in Japan or somewhere else, or they're watching
Europe?
different commercials? Or
Great question. I think it's totally different. And it all depends on where you're living and what those natural native standards are. When we look at these tribes in Africa and you see what they focus on as concepts of beauty, a woman who has 10 rings around her neck, elongating her neck, she's doing it because that's meant to be the most beautiful person in the tribe.
Yeah, well, I saw one of your programs, one of your shows where you actually do the surgeries. Now, I know you're known for the scarless
approach to
it, and of course it's not for the tender-hearted, because I was like, you go in there, I mean, you're digging up at that nose.
No, it's a real surgery. It's a real process. The cool thing with my technique is I'm able to do everything endonasally, means inside the nose, no cuts, no scars. So all the incisions are made inside the nostrils. You'll never see it. There's no telltale sign. And I'm able to give a softer version of the nose without reconstructing it. So it still looks like you.
Yeah, and I saw that because I was expecting, I think it was you had done somebody she looked like her father, but there were issues with the relationship with her father, and you did it to her. And she came out, I was expecting to see this completely different person when she came out, but she looked like herself, just a nicer, more refreshed version of herself, which was great.
So are there downsides to the endonasal approach?
The only downside is that you have to be very specific on patient selection. So not every patient's a good candidate. I tell every patient you should do multiple consults before you ever consider a plastic surgery procedure, whether it's a nose or breast or tummy tuck or veneers, whatever it may be. You need to see multiple consults to understand the different options for you and then pick the best one that matches your needs. So closed rhinoplasty for the right patient is fantastic, low risk, amazing procedure. But if you do it on the wrong patient, it can be a nightmare. So it's all about patient
let's go back a step. What are the reasons, both medical and social and personal, that people need to have something done?
Well, I tell most people that if you're doing it for breathing purposes, fixing a deviated septum, which is the Hollywood reason everyone gets their nose done. If you're getting a deviated septum fixed for breathing, well, that's totally fine. You got to fix your breathing. You got to breathe better. That's a functional.
Can't snore at night. Yeah, exactly. He needs one.
That's the old Hollywood reason. But if you're getting it done purely for cosmetics, which no Hollywood actress does, then you have to think about what is the options for your nose that's going to give you the ideal version of yourself. If you're looking to reconstruct yourself and make yourself into a new person, then there's much more aggressive surgical techniques that exist if that's the right thing to do. And if you're looking just to be the more refined version of yourself, that's where closed scarless rhinoplasty is perfect for you.
You know, we play a game sometimes where, like, if we're sitting on a plane, we're looking at people and we go, had a nose job, had
Yeah.
a nose done. And it's almost like they came out of a cookie cutter.
Cookie
It's
cutter.
like
They
a
all look the
stamp and
same.
the
They
nose
all look the same.
And what I saw from your work that was really cool was that, like Karina said,
It's
they
almost
look
like
a better version of themselves, but it's
but they're
not,
still the same person.
they're not cookie cut from a factory, you know?
That's right. That's right. My whole goal is just to improve patients, keep them on their same trajectory in life, just enhance them by 2 millimeters so they can go a little bit farther, a little bit higher than they were going already.
I know what I wanted to ask you now. If anybody ever needed a nose job, was Barbara Streisand, right? I mean, although I think she's beautiful and I think she's just so exotic looking, but she
Yeah.
said she didn't want to do it because it would change her voice. Is that the same thing that would happen if somebody does your
Closed
procedure?
rhinoplasty? Yeah, it's a good
Yeah.
question. There's a lot of presumptions that closed rhinoplasty, open rhinoplasty, you could have a slight alteration in your voice, but I have done so many famous singers, people's albums who we all listen to on a daily basis,
Oh,
no issues, no
wow.
change in their voices
Oh, let's
at all.
talk. Let's
You know,
talk after
well,
this. I want
yeah.
names. I want names.
We're running out of time. This is such a great topic, and it adds so much because I see my patients, I'll do their mouth, but their nose is like, it's got to be done. Or they did their nose, but their teeth are all, it's all, and really, it all,
It affects-
it all
yeah,
starts,
it
it all
affects-
starts here. Where can we learn more about you?
Well, drdugar.com, and my new book, Beautiful, is coming out May 1st. Everywhere you can buy a book. There's so much more about this on drdugar.com.
Great.
Oh, wow.
Thank
Great.
you so much.
Thank
He's
you.
great, isn't
Yeah,
he?
he's amazing.
Thank you so much for being with us.
much.
Thank you for having me.
We have to take a short break, but there's so much more of Finding the Good Life to come, so please stay with us.
If you or someone you love has developed Parkinson's disease after being exposed to gramoxone or any herbicide containing the deadly chemical paraquat, you may be entitled to financial compensation. If you developed Parkinson's and worked or lived on a farm that used paraquat herbicide treatments with gramoxone, Firestorm, or any listed brand, call now. You may be entitled to financial compensation. There are time deadlines, so don't delay. If you don't win, you pay nothing.
800-908-5340.
Again, listen to this. Medicare Part C plans with extra benefits like getting money added back to your Social Security check every month may now be available to you in your zip code. Make sure you're not missing out. It's simple. 1, call the number on your screen. 2, they'll look up your zip code and see if you're eligible. 3, they'll check for plans with extra benefits like prescriptions, dental coverage, and the benefit that adds money back to your Social Security check every single month. Call now.
I called to get everything I deserve.
I called to check my zip code for a plan with the benefit that adds money back to my Social Security check.
I called to check my zip code.
Check your zip code. It could be dynamite. Call now.
Call 1-800-397-5142. That's 1-800-397-5142 now.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.